In the Eastern Cape, shocking new footage from Dora Nginza Hospital shows pregnant women forced to sit on chairs and lie on the floor while waiting for care. It's the second video of this nature to go viral in less than a month. The Provincial Health Department says it responded immediately by activating extra wards, bringing in agency nurses, as well as approving more doctors for the unit. But the images reveal a deeper ongoing crisis in the maternity care at that facility. Newzroom Afrika's Sipha Kema joins us now live for more. Sipha, very good morning to you. Now, it's not the first time that this hospital has been thrust into the spotlight. Could there be deep-seated governance issues at this facility?
Well, that's exactly what we are trying to find out, Kateho, because this is not a new thing when it comes to Dora Nginza's maternity ward being packed with pregnant women in labor who are forced to sit and sleep on the floor as well as sit on chairs. This has been happening reoccurringly for the past over 5 years or so. It still continues to this day. And it seems as though, Kateho, that the solutions that are brought on by the department are temporary and not permanent solutions, because here we are finding ourselves in this situation. Now, the first video I'm referring to is a video that was sent just on the 22nd of April by women within the who were in the maternity ward on that evening, and they were actually showing how many patients and how many pregnant women were actually sitting on chairs, lying on floors, waiting to be attended to. Same thing, a video also went viral on the 1st of May, and the department did indeed confirm that it is Dora, and it is a recent video from the 1st of May, where it shows women lying on the floor, some of them in labor, needing care, but unfortunately there are shortages of beds. Now, I'm going to bring in one of the members of the legislature from the Democratic Alliance, Mr. Kabelo Makgatosi. Thank you so much, Mr. Makgatosi, for joining us on Newzroom Afrika. Now, this is an issue, long-standing issue that we're talking about. You've conducted oversight at this hospital just now after that viral video. What is the main issue, or even in the meetings that you sit in, what is the problem with the maternity ward of this hospital?
Thank you very much, Sipha. And I think you are right that this is an ongoing thing, and it's been going on for the past 5 years. And we are quite grateful that the dignity has been restored yesterday as an intervention. But however, this is not going to be permanent. So what exactly is the problem? You find hospitals as far as Humansdorp, Grahamstown, which do not have enough capacity, staff capacity. They don't have personnel that actually deals with cesarean deliveries. And that is why now all the referrals are coming to Dora Nginza. So what is the solution? Very simple. You have to hire people in those funded vacancies, and that is where the problem comes in, because even if you open like they did now with C13 that they opened, you still have lack of staff members who are already stretched, and they are working extra hours already with over and above their 40 hours per week as well. So most important thing, as things stand, it is to hire people, as particularly obs and gynae, which is the most needed in some of the hospitals, from Dora Nginza all the way to the other hospitals that are referring patients to Dora Nginza.
All right, thank you so much, Mr. Makgatosi. That's Kabelo Makgatosi there, Katlego, coming from the legislature, member of the legislature for the Democratic Alliance, who they conducted an oversight and held meetings to find out what exactly has been happening at the hospital, more especially the maternity ward. And we will speak to the department as well to get more information, also in terms of strategies in place that are going to fix this for the long term. We'll also be talking to one of the unions so that they can share on the health workers side of things, or what exactly is going on in terms of, we know that most of the issues when it comes to shortages of beds is also being under-resourced as far as staff personnel that is assisting at the hospital during that, which causes then a backlog and a long queue and people not being able to be attended to. Now, that's one of the issues, and we'll also later on be visiting those that have been affected and found themselves in that situation where they're lying on the floor, sitting on chairs at this hospital, Dora Nginza.